Our next speaker is Kevin Tabb. The beginning of the baseball season here in Boston also brings us the world's best-known marathon. This year, the Boston Marathon bombings shocked the world and tore at the soul of Boston. For HMS, restoring body and spirit became a special, often heroic, call to action. Kevin Tabb, President and CEO of Beth Israel Deaconess Medical Center and Clinical Professor of Medicine here at HMS, is here to discuss the lessons that we've learned from the Boston Marathon bombings. He'll focus on how the medical community dealt with both the immediate and the long-term effects, and what the events taught us about overcoming adversity. Kevin.
Thank you. Thank you, Freda. And thank you for having me here this evening. You know, Rachel mentioned a moment ago that she was going to be talking about something different than the previous speakers. I'm really going to be talking about something different than the great research that's conducted here at our medical school, more about the incredible clinical care that's provided at all of the Harvard teaching hospitals. At 2:49 p.m. on April 15th of this year, the world really changed for many of us. At 2:49 p.m., an explosion went off at the finish line of the Boston Marathon. 12 seconds later, exactly 12 seconds later, a second explosion went off, and the world really did change. First and foremost, the world changed for the victims and their families. 3 people were immediately killed, one of them an 8-year-old child. 264 additional people were injured and taken care of at all of the hospitals throughout Boston. Many of them were severely injured. Some of them lost their limbs. And for them, the world really did change. But it wasn't just for them. Really, for the city of Boston, for many of you, I suspect, the world changed also. That Friday, more than 1 million people were locked down in an unprecedented fashion as the search went on for the perpetrators. The world changed for all of us. And the world also changed for the caregivers, for the first responders, for the doctors, for the nurses, and others at our 6 level 1 trauma centers, at our 5 Harvard teaching hospitals. The world really did change also. They faced sights and sounds and experiences that they never thought that they would face. Now, what I find particularly remarkable is that every single one of those 264 victims that got to the hospital eventually survived and was discharged from one of our hospitals. People faced all kinds of things that they never imagined that they would face or see here in this country. At my own hospital, we not only took care of more than 30 victims, we took care of the 2 suspects themselves, the same team. But you know, when I think back on that day, when I think back on the week and the months beyond, it's true. 2:49 p.m., 264 victims, 5 Harvard teaching hospitals. Those facts and figures don't really tell the full story. Those are numbers, and they're true as far as it goes. But when I think back on that time, I think back on a number of stories. And I want to tell you a few of those stories. And I want to acknowledge also that those stories are things that occurred at my hospital, but similar, if not identical, stories played out at every single one of the hospitals throughout Boston. So about 45 minutes after the first explosion went off, I arrived in the emergency department, and I was surprised actually at what I saw. Because what I saw was remarkable calm. I saw over 100 providers working and doing what they had been trained to do with tens of patients in the emergency department. And in the middle of it all, I saw a young trauma surgeon that I'd not met before, who was serving as what we call incident commander. And he was doing exactly what he'd been trained to do. He was calmly triaging each and every one of the patients, making sure that everybody got the right care at the right time. Those that needed to go to the OR went to the OR. Those that needed to get to the floor went to the floor. Within an hour or so, the emergency department was quiet already. Everybody had gone up and gotten their care. And he finished there, went up into the OR, he's a surgeon, and continued his work there. And then afterwards, he continued working into the night, doing rounds on all of those patients that had then been hospitalized. He went from patient to patient, and he stopped at the bed of a young woman who was hospitalized. She was injured enough to have been hospitalized, but she wasn't so injured that she needed to be in the ICU or in the OR. And he asked her if she had everything that she needed, if she was okay, if she was comfortable. She said that she was fine. She said, everything is okay except up here. She pointed to her head. Now, you got to remember, this guy's a surgeon, so he's looking to see if she's got a scalp wound or something. You know, they need no bandages. No, of course, that isn't what she meant, and he quickly realized that. And so he stopped, and he thought about it, and he realized that we were doing everything that we could possibly do for the physical ailment. We were taking care of all of the physical pain. But he also realized, after a really long, hard day, that we weren't, in fact, doing everything that we needed to do for our patients. And so he stopped, and he thought about it, and he came up with a plan right then and there. And the next day, he implemented it, and he brought together a multidisciplinary team, a team of a trauma surgeon and an orthopedic surgeon, a nurse and a case manager, and those are the typical members of a multidisciplinary team that would round on these types of patients. But he also brought in a psychiatrist and somebody from spiritual care. And that multidisciplinary team, a team that thought about the people as people, not just as patients, continued to round on all of those patients for their entire stay and continue to take care of those patients as they come back to our clinics for follow-up. And when I talked to him afterwards and asked him how it was that he, a surgeon, came up with that idea and implemented it, he was surprised that I asked. He said, you know, I saw a problem, I saw a gap, and we came up with a solution to fix it. And what he said to me was, that's who we are. That's what we do. It's the story of an experienced nurse that has worked at our institution for more than 30 years and volunteers every year to work at the finish line of the marathon. She works in the first aid tent, volunteers. She is ready to take care of sprains and dehydration. She was there not 10 yards away from those explosions, taking care of the patients that came in seconds after they were injured. She was there the entire time, got in the last ambulance back to our emergency department, immediately went into the emergency department, took care of people into the night, went home, came back in early the next morning to take care of patients again. But what she told me was that she cried the whole way in. She cried because she knew that she couldn't cry when she got there because she needed to be strong for the patients when she was there. That's who we are. That's what we do. It's the story of that Friday when many of you were locked down. We at the hospital were locked down too. And we went floor to floor, saw all of the patients, talked to all of the staff, and it was remarkable. I didn't hear any complaints. What I heard was people asking how they could do more. But in the middle of all of that, I get a phone call. I got a phone call from a board member. And she said to me, she said, I'm worried about you. I'm concerned. Is everybody okay? I'm worried. And I said, no need to worry. We have never been safer. We've never had more security. We have more Boston police and U.S. Marshals and FBI. They may not talk to each other, but at least they talk to us. And she said, no, you don't understand. I'm a Jewish mother. I'm worried that you don't have enough to eat. Yeah, Boston's locked down. Where are you going? And I laughed, and then I thought about it, and I realized that I'd never eaten as much pizza as I'd eaten that week. But I also realized something else. We talk a lot about the doctors and the nurses and the other clinicians, and it's important to talk about them. But everybody was involved and everybody came together. Dietary services came in second and third double shifts to make sure that our patients and we had everything that we needed. because that's who we are. That's what we do. And so in the weeks after the event, as things got back to normal, at least for us, we conducted a series of meetings with all of the people involved to talk about the aftermath. And inevitably, as we got through talking about the aftermath, talk would turn to the day-to-day running of the hospital. Talk would turn to how we are going to take care of the next patient with an MI, the next car accident victim, the tens of new patients that come in each and every day to all of our hospitals. And somebody was talking about this and then stopped and apologized for talking about the mundane. And that was when I realized something. I realized that the events of the marathon bombing were extraordinary, were emergent. And in extraordinary and emergent times, we're expected to step up. That's what happens. But you know, I realized something else. I realized that perhaps the behavior was not so unusual. When our people see gaps in care, problems with the system, and believe me, they see those things all the time, they step in and figure out what to do. They do that every single day. When our doctors and nurses work with our patients to ensure that they not only feel but are safe and secure, they do that every single day. When people come in without being called or stay long extra well beyond their shifts, they do that each and every day. So in hindsight, I'm not sure why I was surprised. Because I think in many ways, for many of the people that provide that care, this was really not extraordinary. It was our ordinary. Because that's who we are, and that's what we do. Thank you.
Actually, no, thank you for all the work that you did then and continue to do. I have to ask, as a leader, we come upon our equanimity under duress from different life experiences. Where are some of the experiences that you've had that, you know, kind of gave you the ability to deal with these very odd and dramatic circumstances?
Yeah, you know, I hate to say it, but unfortunately this was nowhere near the first time that I've experienced this sort of event. So I come from Israel, and I trained and practiced there. And the sad truth is that in some ways in Israel we have gotten used to dealing with this sort of thing. This sort of thing being mass casualty events, this sort of thing being taking care of the victims next to the suspects. And you know, what surprised me the most is in my training in Israel, we were used to this. Here, thankfully, we're not. I hope that we never get used to it. And nevertheless, I was incredibly proud of the way that people stepped up and did what needed to be done.
And I can't resist, beyond the heroism and the commitment, if you actually look back on this and ask yourself, was there anything that we could have or should have done in preparedness or in our work? Is there anything that stands out for you?
Absolutely. You know, you can't go through events like this without asking yourself, what would you or should you do differently next time? And while there were many, many things that I think we did right, I think there were many things that could have been done better. One of the things I think that we all realized as all of the people that ran the different hospitals in town was that we had all trained and practiced again and again, but we had done that in isolation. And what we really needed to do was to come together and figure out how to work together. You know, there was more than one occasion where two members of the same family were hospitalized in two different hospitals, and we needed to figure out how to bring people together. Wasn't something we'd thought about before. So I hope that there isn't a next time, but if there is, we will do even better.
Be ready.
Yeah.
Well, thank you so much for everything.
Thank you.